Hello, my name is Dr. Monica Flores. I'm a pediatrician in South Florida since 2001. In this series of videos, we will cover normal newborns, their routine care, precautions, and all the weird things they do. These are the ABCs of newborn care. Newborn poop changes from a black color at birth to a yellow or lime green color in a few days. The frequency of poop can be 16,000 times a day, or so it seems, to as little as once every 6 to 7 days. The frequency does not matter as much as the consistency. Only liquid comes in, only liquid goes out. Normal newborn poop should be the consistency of cottage cheese, but no thicker than cream cheese, and it should never be white, black, or red. As they eat, their stomach expands, pushes on their diaphragm, and causes spasms, which are hiccups. Newborns with hiccups are full and happy and not in distress. Some newborns spit up a lot, even every feed. If the spit up is progressive, today 3 times, tomorrow 13, and the next day 33, or projectile where it hits people across the room, then talk to your provider. Babies who spit up frequently need to be weighed frequently to make sure that enough food is staying down. A good rule of thumb is to feed your baby when they are hungry and stop feeding them when they're full. For those mothers who are breastfeeding, make sure that you continue to take your vitamins, drink lots of water, and rest. The more relaxed you are and the more frequently your baby feeds at your breast, the more milk you will produce. An exclusively breastfed infant needs to take vitamin D daily. If you are having problems establishing breastfeeding, do not be afraid to reach out to your provider, a lactation consultant, a friend who's done it previously, or grandma. Those first few weeks are vital in establishing your milk supply. In my opinion, exclusively breastfeeding is one of the hardest things a mother will ever do, even harder than delivery. If you are formula feeding, you know that they're getting enough because they leave a little left over. If they are sucking the bottle dry, it's time to feed them more. It is okay to give a newborn both formula and breast milk, even at the same feed. Although breastfeeding is best, don't beat yourself out about it if it doesn't work out. Give as much as you can, as frequently as you can. Even a teaspoon a day gives a baby immune support. Some babies like to eat in clusters. They eat every 20 to 60 minutes for several feeds, and then they take a long nap. Other babies like to maintain a schedule, every 2 to 3 hours. Until we know that the baby is gaining weight well, wake them up to feed a minimum of every 3 hours. You do want to teach your newborn that days are for eating and nights are for sleeping. During the daytime, wake them up every 2.5 hours to eat. To wake them up, get them naked, get them cold, bother them. Once your newborn shows that they are gaining weight well, if they decide to have a longer sleep, 4 or 5 hours in the middle of the night, let them. Just do weight checks to make sure that they are gaining weight appropriately. Pooping is something that your baby needs to learn to do. When they were inside of you, they never had to do it. Once they are outside, their muscles are not strong. They are laying down. They don't know how to coordinate pushing their belly muscles and relaxing their rectal muscles. So babies may seem uncomfortable pooping. They may grunt. But the grunting should not last longer than 20 seconds. To help your baby poop, you can massage their belly, sit them up, or bring their legs close to their belly. Not all babies burp. The babies who suck air when they eat will burp more. If you are breastfeeding or use a Dr. Brown's bottle, your baby may not burp at all because they form such a good seal that no air is sucked in. If your baby does not burp right away, lay them down. And if they are uncomfortable, try again. If they don't burp, don't worry. Whatever air is not burped out will eventually work its way down and out. Try to avoid using a pacifier. Babies who use pacifiers for long periods of time are more prone to ear infections, and pacifiers can affect the architecture of their teeth, causing an overbite. Increasing spit up, stools harder than cream cheese, stools that cause a rash, eczema, or colic may be a sign that your newborn has milk protein intolerance, which is easily diagnosed with a simple poop test to check for blood in the stool. You may find yourself staring anxiously at your newborn, wondering if they are doing as normal. To continue to learn the ABCs of newborn care, what is normal and what is not, subscribe and view the whole series.